NCLEX RN Exam Test Questions 2026 to challenge your understanding. Question 1. A 55-year-old client has been diagnosed with atherosclerosis. Which of the following lifestyle modifications should the nurse emphasize? Option A. A focus on overall health rather than weight. Option B. Incremental increase in low-intensity exercise. Option C. Adherence to a heart-healthy diet low in saturated fats and cholesterol. Option D. Counseling on stress management techniques. The correct answer is option C. Adherence to a heart-healthy diet low in saturated fats and cholesterol. A diet low in saturated fats and cholesterol directly targets the primary cause of plaque buildup and atherosclerosis. Question 2. A client has undergone a laminectomy to relieve spinal cord compression. Which technique should the nurse use to reposition the client safely? Option A. Log roll the client carefully to maintain spinal alignment. Option B. Assist the client to dangle on the side of the bed. Option C. Encourage the client to use an overhead trapeze. Option D. Instruct the client to perform gentle range of motion exercises. The correct answer is option A. Log roll the client carefully to maintain spinal alignment. Log rolling ensures that the spine stays aligned as a single unit, preventing stress or injury to the surgical site. Question 3. A client who just had cataract removal is being prepared for discharge. Which of the following should be included in the discharge education? Option A. Restrict fluids to limit urination. Option B. Avoid lifting objects heavier than 5 pounds 2.25 kilograms. Option C. Remain in a prone position while resting. Option D. Refrain from straining during bowel movements and avoid bending at the waist. The correct answer is option D. Refrain from straining during bowel movements and avoid bending at the waist. Straining and bending increase intraocular pressure, which can damage the surgical site or displace the new lens. Question 4. At what age should the nurse emphasize the initiation of regular testicular self-examinations? Option A. At the onset of sexual activity. Option B. After the age of 69. Option C. Starting after age 40. Option D. Prior to the age of 20. The correct answer is option D. Prior to the age of 20. Testicular cancer is the most common cancer in young men, ages 15 to 35, so habits should be established before age 20. Question 5. A client's surgical wound site has suddenly dehisced, and there is evisceration. Which step should the nurse perform first? Option A. Promptly notify the surgeon. Option B. Immediately cover the eviscerated tissue with a sterile saline dressing. Option C. Check the client's vital signs. Option D. Attempt to gently approximate the wound edges. The correct answer is option B. Immediately cover the eviscerated tissue with a sterile saline dressing. Protecting the exposed organs with a sterile, moist dressing is the immediate priority to prevent tissue drying and infection. Question 6. The nurse observes a patient's respiratory cycle increasing and decreasing in depth and rate, with periods of apnea. This observation is most consistent with Option A. Progressively deeper breaths followed by shallower breaths with apneic periods. Option B. Rapid, deep breathing with abrupt pauses. Option C. Rapid, deep breathing without pauses. Option D. Shallow breathing with an increased respiratory rate. The correct answer is option A. Progressively deeper breaths followed by shallower breaths with apneic periods. This describes Cheyne-Stokes respirations, often seen in end-of-life care or severe brain injury. Question 7. Which type of breath sounds is the nurse most likely to auscultate that are typically associated with heart failure? Option A. Atracheal. Option B. Fine crackles. Option C. Coarse crackles. Option D. Friction rubs. The correct answer is option B. Fine crackles. Fine crackles are the classic auscultatory finding for pulmonary edema associated with left-sided heart failure. Question 8. A patient in an acute asthma exacerbation who was wheezing loudly suddenly has no audible breath sounds. What is the most likely explanation? Option A. The asthma attack has resolved. Option B. The airways are so constricted that air cannot pass through. Option C. The inflammation within the airways has subsided. Option D. Fine crackles have replaced the wheezes. The correct answer is option B. The airways are so constricted that air cannot pass through. A silent chest is a medical emergency indicating that air movement is insufficient to produce sound.